My name's Dr. Laura Bonnett, and I'm in charge of the taught postgraduate provision in the Department of Health Data Science at the University of Liverpool. And I'm delighted that you're interested in our MSc in Data Science and Analytics for Health. This course is perfect for anyone who has a background in mathematics, computer science or health research and would like to have an opportunity to focus on some more statistical or computer science aspects. We offer two versions of this programme. There's a full-time version in 1 year and there's a part-time version in 2 years. And overall, the entire course is worth 180 credits. And you have lots of opportunity for choice, as well as the dissertation module that is worth 60 credits in the final semester of your degree. We're really proud of our course because we have 3 things that make it extra special. First of all, we've got a highly expert team of teaching staff who go above and beyond to help that you understand all the content and can fully engage with the course. We're delighted that each year we welcome a really multicultural and diverse cohort of students too. We have people coming to our course from the UK, from Nigeria, from Ghana, from India, so it really is a multicultural course. And also, we're very keen to promote the extracurricular side of our programme too, not just taught content and assessments, but also helping you develop as an individual. So we offer training in communication skills, we offer training in multiple computer programming languages, and we also provide consultancy skills to ensure that you're set up for the best possible work environment when you graduate. So throughout the course, you'll be taught by world-leading researchers and experts in their field. You'll also have the opportunity to meet a variety of additional staff and colleagues through our guest lecture series. You'll have interactive workshops, you'll have interactive lectures, and you'll also have lecture practicals. So no matter your learning style, we truly offer something for everyone. Now, I know that nobody enjoys assessment, me included. But what we offer throughout this programme is a variety of different assessments that we call authentic. So they prepare you for the different tasks that you might be expected to do as a qualified health data scientist. For example, we offer analysis of data sets. We offer oral presentations, poster presentations, preparation and delivery of statistical analysis plans, coding exercises, and of course the research project, your dissertation, which I will talk more about later. Now, the MSc in Data Science and Analytics for Health has 2 core modules as well as the dissertation module. These 2 core modules offer an introduction to health data science and an introduction to computer programming. Now, as module coordinator for Introduction to Health Data Science, I can say that this is an excellent module. It offers you a grounding in what health data science is, what team science might be, and it also covers the basics, study design, types of data, and also some of the softer skills. So we're thinking about public and participant involvement with research, governance, data, and data management plans. There's 2 assessments, one of which is a critical appraisal of a published journal article, and the other is a plain language summary of an interview with a health data scientist. So already you get an opportunity to meet and interview someone from the world of work. The second core module is Introduction to Computer Programming for Health Research, and this gives you a really good opportunity to upskill or to indeed learn a new programming language. We know that programming is a vital skill for future employment, and many of us can code in 1 language, maybe 2. Over the course of this module, you'll get the opportunity to learn R, Python, Git and SQL. And there are 2 assessments here, one of which is on SQL to query a database, and the other is on Python. So again, preparing you for the world of work via an interactive module with lots of guest lectures and lots of opportunities to have a go. The rest of semester 1 in your first year if you're a part-time student, or in semester 1 if you're a full-time student, is entirely up to you. You can pick 2 modules from our list of 4. We have an Introduction to Statistics module if you're coming from perhaps a computer science background. We have an analysis of public health data. Perhaps you want to see what it's like to analyse public health data sets. We also have an Introduction to Qualitative Research Skills, so that is more the softer side of research, perhaps in terms of people's quality of life evaluations, interviews, focus groups, and those sorts of things. And we also have an Introduction to Research Skills module, because we find that many people with a numerical background come to a master's degree without having had the opportunity to really undertake a deep dive into research. So this is an opportunity for you to have that training. Don't worry if at this point you're like, I don't know which modules I'd pick. That's absolutely fine. We're a really supportive faculty and we provide lots of opportunity to help you choose your modules before you arrive and also once you arrive. So don't worry, we are here to help. In semester 2, the choice is even bigger. You can choose 4 from 10 modules. And these modules are kind of grouped into 3 different sections. We have some computer science modules that are looking at machine learning, biooptimization and things like that. We have some general healthcare modules that are thinking about actionable healthcare data analytics and introduction to clinical trial methodology. And then we have 4 statistics modules that are a deep dive into statistical methodology. That might be into genetics, it might be into machine learning and artificial intelligence, might be high dimensional data, or it might be prediction and joint modeling. So the choice really is yours, and this enables you to either upskill if you've got some background in these, or learn a new skill, helping you to prepare for graduation and whatever follows. Whilst the dissertation module is obviously core, there is a lot of choice within it. We can guide you to choose a title for your project. We provide a list for you to pick from, or indeed you can suggest your own data and your own title for a project, and we can help you to develop that idea into some sort of reality. There's also lots of support throughout the dissertation module, which takes place in semester 3 of year 1 or year 1 and 2 if you're a part-time student. We offer weekly meetings with your supervisor, and your supervisor is one of the excellent faculty here in the Department of Health Data Science. We also offer training on introduction to database management, introduction to literature reviews, introduction to citations and reference managers, all the different key skills that you will need to undertake this research. And indeed, some of our graduates have gone on to present their dissertation results at international conferences or publish them in journal articles, which is a massive achievement for an MSc student. And we're hoping that you'll be able to do the same with your dissertation too. And while we're talking about graduates, I'm delighted to share with you the destinations of some of our own graduates. For example, some people have gone on to work for Public Health England. Some have gone to work back in their home countries doing data analysis and teaching statistics. Some people have returned to their medical careers as either animal health expertise, vets, medics. And we've also had people who have entered further training through, for example, the Deloitte internship programme. We're also really proud that many of our graduates have stayed within the Department of Health Data Science. They are now research assistants and or PhD students. So really graduating with an MSc in Data Science and Analytics for Health opens a million doors and opportunities.
The course has a team science feel to it. It has a team science approach to it, and which means that it doesn't matter what background you have, whether you're from the mathematical science or from the biological sciences, or like me, coming from the social sciences. There's something for you. And then the reason for this is because, you're creating, the course is creating a pool of people that are able to provide the high-level policy-related the research, answers to research questions that the health system in the United Kingdom is hoping to answer. Secondly, the facilitators, the module leads, the teachers on the course, they are very, very helpful people. They are very friendly, most importantly, and also academically, given their wide background, that diverse background in the industry and with academics, they're able to help to a very, very great extent. And lastly, Liverpool is a very beautiful city. As you probably can see behind me, we have, very beautiful structures, a very nice place to live in, very nice people to live with.
If you would like to find out more about our MSc in Data Science and Analytics for Health, please just ask. We welcome applications for anybody with a 2-2 undergraduate degree or equivalent, depending if you're an international student. For this particular programme, we ask that you can demonstrate previous experience of some sort of quantitative analysis. You may have work experience, you may have undergraduate modules. If in doubt, just ask. And if you've watched this video and thought, brilliant, excellent, and then realised that you don't have that numerical background, don't worry. We also offer an MSc in Data Science for Health conversion course for anybody who doesn't have that numerical background, and details are on our website. If you're an international student, please be aware that you need an IELTS 6.5 overall, with no particular category less than an IELTS 6.0. But again, if in doubt, just ask. The MSc in Data Science and Analytics for Health in the Department of Health Data Science at the University of Liverpool offers a wonderful student experience in the original red brick university in a fantastic northern UK city. I look forward to receiving your application soon, and I hope to see you on campus in the not too distant future.